Hello, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this video, I'll be going over a little bit about the sugar tax and which are out of sugary sweetened beverage. It's true that beverages are not good for the body in so many different ways. Regarding this, because of this, Newfoundland and Labrador are taxing about 20 cents per liter of sugar sweetened beverage. So three places, Philadelphia, which is the United States, United Kingdom, and Mexico are actually charging these beverage taxes. Is it good? Depends on who you talk to. I think that the World Health Organization, Diabetes Canada, Heart and Stroke Foundation, they're touting this as being a panacea. Sugar sweetened beverages may not be good for you necessarily, but there's a type of taxing. There's excise taxes or flat taxes, which also make them kind of like regressive taxes. So the idea is that because it's a flat tax, individuals that are poor will not be able to afford, and the tax is actually a higher percentage of their income rather than a high income person. So what it is that how it's stigmatizing also individuals who are obese maybe there's going to be stigma around that, because immediately individual behaviors are thought of as the cause, when in fact this is actually very much a tax against the poor. Additionally, in the First Nations communities, there's actually potential to harm small businesses, because a lot of them actually carry sugary drinks. So the idea would be that the sugar sweetened beverage taxation, it actually is almost it's a weight stigma, and that the health policies that actually have sweetened drinks it's being considered as the only reason. And there are many calls to action to end weight stigmatizing policies. And yet stigma occurs in part when a label such as obesity is in association with sugary drinks. So I'm going to pull up an article on stigma and obesity, which was it's published actually in the Lancet Public Health. And this is why I was saying at the very beginning that stigma and obesity has been being described further. In October of 2019, this paper was published. And you can see that the stigma is there. Overweight obesity affects 2 billion people out of the 8 billion. So it's 25%. And prevalence has nearly tripled over 40 years. So obesity is a chronic, complex disease and a driver of non-communicable diseases. Without adequately addressing obesity as a health issue, current efforts to achieve universal health care spearheaded in 2019 at the United Nations General Assembly will fail. Yet obesity is not effectively prevented or managed across health systems and societies. So how people are at a loss as to how obesity should be understood on a population level, on an individual level. Traditionally, when there's explanations on obesity, there's usually a council of lifestyle modifications and other things. But if the individual can't afford to take action on this, then that becomes a social issue. So the low priority, why is obesity, stigma, and things like that being given low priority. And so the low priority attributed to obesity is reflected in the failure to develop and finance comprehensive approaches to population-wide obesity prevention within and beyond the health sector, as well as evidence-based treatment. So you have to complement one with the other. There's actually 9 non-communicable diseases targets set by the World Health Organization, agreed by all member states in 2013, only 1, to halt the increase of diabetes and obesity at 2010 levels by 2025. We're going to be missing that in every country. That's sad. Obesity is considered neither as one of the World Health Organization's 5 major and non-communicable diseases, nor as one of the 5 non-communicable risk factors. Bottom line here is there's a lot of inertia, a lot of hesitation in addressing obesity because framing of obesity has become personal responsibility, not about other things. And there's a conscious or unconscious bias over overt fat shaming or covertly having unconscious biases. So health professionals and policymakers, they're the worst offenders in manifesting this, but they need to be stepping up, and professionals and policymakers should provide the supportive care. The complex drivers of fat mass regulation are not widely understood by healthcare professionals, nor included even in most medical curricula or public health training. So addressing obesity as a chronic disease requires understanding the biological regulation of food intake and the physiological mechanisms that control regulation of fat mass. So even modest weight loss, including glycemia, blood pressure, lipids, mobility, and quality of life, benefits that do not require a return to so-called normal BMI. So weight loss should not be at the primary forefront, but understanding it as a chronic disease, and that there are a lot of physiological mechanisms beyond the patient's control to be affecting fat mass. Understanding this will help prevent stigmatization of children, young people, and adults with obesity, which is unethical and violates patients' human rights. So neglecting and stereotyping is not good. So what do we do? Well, programs should incorporate medical and population health training. And so as we celebrate, this was actually released for World Obesity Day in 2020, March 4th. We share a collective, and this is like a pledge, we share a collective responsibility to identify obesity and stigma as the crux of the matter, a central driver of the world's NCD burden, and to take a central role in reshaping the narrative, placing people with obesity at the center of our policies and practices. I think this sums up how we should look at stigmatization and obesity in particular. Thank you for listening.